In today's video, I'm going to show you how to find your pelvic floor muscles and how to properly perform a Kegel or pelvic floor contraction. Everyone has pelvic floor muscles, which means this video is for anyone and everyone, regardless of your gender. I'm Dr. Alex Hill, your physical therapist for everything oncology and pelvic health. Let's dive into those muscles. First, let's start with what and where are the pelvic floor muscles. The pelvic floor muscles sit at the bottom of the pelvis. They kind of sit like a bowl. They help to support all the organs that sit inside. They stabilize the pelvis, they control the bowel and bladder, they have a sexual function, and they also help with pelvic circulation. Let's pause here just very briefly for a little history lesson on Kegels. Way back in 1948, an American gynecologist named Dr. Arnold Kegel first described Kegel exercises as a way to treat urinary incontinence or leakage. In a general sense, Kegels are repeated pelvic floor contractions. So this goes into who should and who shouldn't do Kegel exercises. First, it's always best to see a medical professional, especially a pelvic floor physical therapist, for a full assessment of the pelvic floor to see if Kegels are right for you and to help guide you through a comprehensive program. But in general, if you're experiencing symptoms of pelvic floor weakness, Kegel exercises are likely going to be helpful for you because they're going to strengthen the pelvic floor. Conditions of a weak pelvic floor can include stress urinary incontinence, which is when urine leaks, when you cough, when you sneeze, when you're laughing, jumping, anything with exertion. This is common after the prostate is removed after prostate cancer treatment and also during and after pregnancy. But if you haven't gone through these events, you can still have stress incontinence. If you leak stool or you can't control your gas, like you're changing positions like in yoga or going to stand up or kneel down, Kegel exercises can help strengthen the muscles and the sphincters to help keep things in. Finally, if you have pelvic organ prolapse, which is when the bladder, right here, the uterus, or the rectum start to drop down into the vaginal walls, Kegels can also be helpful for you. Now, if you have symptoms like urinary urgency and pelvic pain, anything like painful bladder syndrome or interstitial cystitis, if you have chronic prostatitis, tailbone pain, vaginismus, endometriosis, or any other pelvic pain condition, repeated pelvic floor contractions can actually do more harm than good for you. So subscribe to my channel for future videos on how to manage these other conditions, but even better, work with a pelvic health physical therapist. I'll make sure that I'll include some links down below on how to find someone near you because they're going to provide a full assessment for you and an individualized program. Okay, now the moment you've been waiting for. Let's get into how to actually do a Kegel. Some helpful hints for you. When you do a Kegel, no one should be able to tell that you're doing it, right? These muscles are on the inside. You shouldn't be moving your belly or your butt. If you're clenching your bottom or you're holding your breath, moving muscles besides the pelvic floor, that's not helpful. Next, do not hold your breath when you do Kegels. And finally, try different positions. Lying down may be better for your muscles if they're very weak and if you have a hard time contracting them. You can also try Kegels sitting or in a more challenging position in standing. Really think about the position or the positions that you're having your leakage or your prolapse symptoms in and practice them in those positions. For this video, I'm going to be doing the Kegels sitting down. Alrighty, here we go. So first, make sure that you're sitting up nice and tall. Next, what I want you to do is gently contract the pelvic floor like you're trying to stop your urine or your pee midstream. Because the muscles wrap all around the openings, the urethra, the vagina, and the rectum, or for people with a penis around the penis and around the rectum, you should be feeling the front and the back both pull up and in. Okay, so even though you're feeling like you're stopping the flow of urine, I want you to feel the front and the back contract. Okay, so let's try a couple of those. Squeeze like you're stopping yourself from peeing, and then relax. Squeeze, stop the urine, and relax. Now, if the image of stopping your pee didn't quite do it for you, let's try contracting the rectum, like you're trying to not pass gas. Again, even though we're focusing at the back, you should feel the front and the back both contract. So let's try squeezing the rectum up and in, not your butt cheeks, and relax. Squeeze the rectum up and in, and relax. One more time, squeeze up and in, and relax. Now, if you're still having trouble finding those pelvic floor muscles, that's okay. Let's try a couple other images to see if we can kick on those muscles. Now, I want you to imagine that the pelvic floor muscles are like an elevator. As you contract, the muscles contract up all the way to the penthouse, and then as you relax completely, the muscles go all the way back down to the ground floor. Let's try that a couple times. Contract, pull the elevator all the way up, pause, and then relax all the way back down. Pull the elevator up, contract all the way to the penthouse, and then relax. Great. Now, if you're still having trouble, that's okay. These are hard to do for some people. Let's imagine the pelvic floor is a flower. As you contract, you're going to pull all the flower petals into a tight bud and then relax and open up the flower petals, okay? Let's try a couple of those. You're going to contract, pull the flower petals into a bud, and then let them go. Pull them into a bud, good, and then let the flower petals open. Now, if you notice that you're having a hard time relaxing the pelvic floor, or it's taking a really long time to come down from that contraction, I want you to really focus on the sensation of relaxing the pelvic floor muscles. There really shouldn't be a delay. Relaxing is really going to be more important for you to work on initially instead of contracting the pelvic floor muscles to strengthen them. All right, now that you know where your pelvic floor is and how to do a Kegel, the next questions are really how long should you hold them for? How often should you do them? Now, if you're not having any type of pain, difficulty relaxing the pelvic floor, start out with holding for 5 seconds and then relaxing for 5 seconds. As that gets easy, work your way up to 10-second holds. And I also want you to work on quick, powerful contractions. You can do sets of 10 of both the long and the quick ones. Make sure you relax completely in between. You can do Kegel exercises several times a day, but remember, they're muscles just like any other muscle in your body, and they can get fatigued. You don't need to overdo it. I hope this video was helpful for you in finding your pelvic floor muscles and correctly doing a Kegel exercise. If you had trouble, again, don't stress about it. Keep practicing and work with a pelvic health physical therapist. Again, I'm going to include a couple links down in the description to help you find someone near you. Make sure that you subscribe to my channel, turn on those notifications so you don't miss anything else pelvic health related. Happy Kegeling!